This video will demonstrate several techniques used in cytology to collect samples for cytologic examination, including fine needle aspiration of solid tissues such as masses or superficial organs, the tracheal wash procedure for cytologic evaluation of the respiratory tract, sampling of effusion fluid from the abdomen and thorax, fine needle aspiration of a mass or of a superficial organ such as a lymph node enables the diagnosis of both inflammatory and non-inflammatory conditions. One should keep in mind that cytology is a screening tool used in the diagnostic process, such that in some cases complementary histopathologic examination may be required to confirm a diagnosis or to further characterize a lesion. Cytologic sampling is a quick, simple, relatively inexpensive, and minimally invasive technique. For fine needle aspiration of solid tissues such as subcutaneous masses, few materials are required. A 22 to 24 gauge needle, 1 or 1.5 inches long, depending on the depth of the lesion being sampled, a 12 to 20 cc syringe, and glass slides. Two techniques may be used: sampling with a needle only, or sampling with a needle attached to a syringe. By using a syringe, negative pressure can be applied, enhancing the exfoliation of cells from the lesion. However, the easiest technique is to use the needle alone. If this method does not yield an adequate sample, aspiration using a syringe should be attempted. Restrain the patient appropriately. In some cases, sedation may be indicated. It is not necessary to shave or to disinfect the aspiration site. The most crucial step in obtaining a sample of adequate cellularity is to ensure that a sufficient number of passes are made through the tissue with the needle. Once the needle is inserted into the mass, move the needle quickly back and forth at least a dozen times. This allows cells to be collected into the needle tip. Turn and reorient the needle and repeat the passes. If blood enters the needle, stop sampling, remove the needle, and spread your specimen on a glass slide before clotting occurs. If blood contamination of the specimen is significant, the sample quality may be poor, and the procedure should be repeated until a sample that has little or no blood contamination is obtained. If a syringe is used, apply negative pressure by pulling back on the plunger 2 to 3 times. This will favor cellular exfoliation. Reorient the needle and repeat the procedure. After releasing the plunger, remove the needle and syringe. Detach the syringe, pull the plunger back to load the syringe with a few cubic centimeters of air, reconnect syringe and needle, and eject the needle contents onto the end of a glass slide. Spread the specimen by gently laying a second glass slide over the first without applying pressure. Too much pressure will damage the cells and result in a non-diagnostic sample. Allow the specimen to air dry. If you obtain a very fluid sample, spread it with a second glass slide in a manner similar to that previously described. You may also spread the specimen with a second glass slide held at an angle, as you would for the preparation of a blood smear. However, for a cytologic specimen, stop the smearing abruptly in order to concentrate nucleated cells on one end of the preparation. Concentrating the cells in one area of the slide facilitates microscopic examination. If abundant clear fluid of low cellularity is obtained, it may be centrifuged to concentrate the cells. The sediment obtained after centrifugation can be used to prepare the slides. A modified Wright stain can be used to stain cytologic specimens. The thicker the smear, the longer the glass slide should soak in each solution. Do not soak the slide less than 10 seconds in each solution, and allow equal soaking time in each solution. Soak the slide in methanol, soak in the orange stain solution, and soak in the blue stain solution. Finally, rinse the slide in clean distilled water that has a neutral pH of 7.0. Allow excess water to run off the slide and allow it to air dry. Note that it is not necessary to fix your slides with a fixative solution or spray prior to staining. The air-dried slides may be sent unstained to an external laboratory if you're not going to review the slides yourself. The modified Wright stain that is commonly used may not stain certain mast cell tumors very well, making a diagnosis difficult. For these tumors, a Wright's or Wright-Schemza stain is recommended.